In the next 5 years, the greater Utica area will have a brand new state-of-the-art hospital, but that costs money, and a lot of money. News Channel 2's Kristen Copeland spoke to economic development officials here at home that say that it's worth the big check. And building a new facility builds on the momentum that our region has seen in the last 3 years.
Now, the hospital's a major employer. This is a unique opportunity to basically provide a new healthcare campus that's going to serve this region for the next 75 plus years.
The Mohawk Valley Health System is going to cost $500 million to build and open. $200 million will be covered by hospital savings, borrowing, selling assets, and fundraising. And the remaining $300 million is secured in the state budget.
Because there's an awful lot of people that didn't want to see us get this.
There were many who were not happy. In fact, on the floor of the Senate, in debate, the New York City people brought it up because they couldn't even pronounce Oneida. They said Oneida. And they couldn't understand how New York City, with 8 million plus people, were getting $800 million. And Oneida County, with not even 250,000 people, were getting $300 million.
Since the affiliation of Faxton-St. Luke's and St. Elizabeth became official in 2014, hospital officials have realigned services, saved money, and showed that this new hospital is going to be sustainable.
You know, they're really rewarding us for good behavior. We came into this with a 5-year, $56 million cumulative savings, so not in a year, but over 5 years. And the last report I saw is projecting things out over 5 years. We've already accomplished 49 of that.
4,500 people will work at the new hospital when it's up and running, but even more could bring home a paycheck as a result.
Construction jobs and the people who work on the campus. There's also the opportunity to look at, filling gaps in certain disciplines and in medical components that perhaps are lacking in the region and perhaps could be incorporated as part of an overall plan. We're obviously looking to try to leverage this project with something that would hopefully have more of a spillover benefit.
This spillover could include housing, commercial development surrounding the hospital, and also restaurants and retail.
This is an opportunity to build part of the infrastructure and improve the storyline for the region. So it's a chance to put a little bit more sizzle in the region.
Now, hospital officials plan to make a decision on a location for the new hospital next month and have it built and open by 2020.